Is it really essential to take medication after a transplant procedures? Many times during consultation you used to encounter like people used to come and tell like I have heard, I have seen some videos that medicines have lot of side effects. I don't want to take medicine. I just want to go for hair transplantation. Let's discuss in details about importance of medical management in your hair restoration journey. So you have to realize that hair loss has a two segment in terms of management. One is medical management, one is surgical management. Both are important to protect and to prevent your ongoing process of baldness. Point number one, suppose you are grade 3 or grade 4 baldness, I mean you have balding only over the front and you have a good amount of existing hair in the back and the crown area. With transplant you will get very good result in the front, but if you are not taking medications, with the ongoing process of baldness you may lose hair from the back of your scalp, and down the time, maybe after 2 years, maybe after 3 years, how fast your baldness is progressing, you may need another sittings. If you want to prevent second sitting or third sitting in future, then it's better to continue medication to stabilize the process and also to protect your existing hair. Point number 2, sometimes the process of baldness is not complete. You still have good amount of existing hair. Suppose in an area of 1 into 1 centimeter you have around 20 hair, and with the transplant we have put another 40 hairs, so final density becomes 60. With the process of baldness in future you may lose this hair just because they have a tendency to undergo this process of baldness. So down the time, 2 years, 3 years, you may feel like your density of your transplanted hair that you have achieved after 1 year is coming down and reducing. This is not because of loss of your transplanted hair, this is because loss of your existing hair. So to protect and to maintain the density that you have achieved after 1 year, it's good idea to have medication on and off under supervision. Point number 3, this is more important especially when somebody is planning for hair transplant in the younger age group. Younger means below 30 years. What we have observed, the donor of a person below 30 years and donor of a person at 40 years is different. In younger age group, the donor we call it a dynamic donor. That means suppose at present, suppose this is of this breadth, with time it may shrink from below, it may shrink from up. So this process is known as the reverse baldness. Suppose during the procedures, if the grafts have been picked up from this relatively unsafe zone, in future because of this process that may undergo thinning. So this is known as the long-term thinning we have observed in some person, especially those who have done hair transplant in a younger age group. So if you want to maintain, if you want to retain the density of your original transplanted density, then it's better to take medication to protect this transplanted hair. Fourth point is there is a concept known as recipient codominance or recipient co-influence. Though we call these are the permanent hair and this is non-balding zone and it retains its property, but what happens when this graft gets implanted into the recipient area, into this balding zone, recipient area microcirculation, vasculature or microenvironment also affect this permanent hair. So what I have observed, after 2 years, 3 years, the transplanted hair may shrink in volume. I mean, suppose in an area we have put 40 grafts, out of 40 grafts, 40 will be there, but there will be some thinning of the individual hair in terms of thickness. So after 2 years, 3 years, you may feel your volume of the transplanted hair is going down. So this is because of the influence of your recipient area, and we have observed by taking DHT blockers like finasteride, dutasteride on and off. Also there are other treatment like PRP really helps in maintaining your original transplanted density and to also helps in preventing long-term thinning. So these are points which indicate that medical management has important role to protect your existing hair. So it's better to take medications on and off to maintain your original hair and also to maintain your transplanted hair. and it is pretty safe and effective treatment to protect your existing hair and also to maintain the density of your transplanted hair. Thank you.